Thanks very much, Will. Good morning, everyone. I'm really delighted this morning to be joined by three colleagues, John Fraser, the Ontario Liberal MPP for Ottawa South, and our caucus's critic for the Ministry of Health and Long-Term Care, Jill Promoli, who is the Ontario Liberal Party candidate from Mississauga-Streetsville, and Dr. Nathan Stahl, who is the Ontario Liberal Party candidate from Toronto-St. Paul's. And this morning, the four of us want to speak with you about where Ontario finds itself at this moment of time in the fight against COVID-19. So let me begin by saying we all know, everybody in this province knows, how exhausted the people of Ontario are because this public health crisis, this pandemic has now been dragging on for 19 or 20 months, or perhaps even more than that at this point in time. I know everyone's tired. We know everyone's tired. We know that more than anything else, we want to be truly to the other side of COVID-19 so that we can focus on our recovery, so that we can focus on once again building up Ontario's resilience for the nearly 15 million people who call our province home. But we're not there yet. We're not there yet. And over the last number of days, of course, we have all seen as the COVID-19 numbers have started to climb again. Just a few days ago, we heard from Ontario's science table about their concerns given that the numbers are heading once again in the wrong direction. And so today we are here to strongly urge Doug Ford to take strong leadership action and move forward in some critically important areas according to what the evidence and the science is telling us. Now, you've all heard me say throughout this pandemic that far too often, in particular during the third and fourth wave, that Doug Ford moved far too slowly, that far too many of his actions were half-hearted. They were grudging. We've seen that around vaccine mandates. We've seen that around the vaccine certificate. We saw that with paid sick leave and so much more. But we are now at a place where it seems to me, and I think it seems to most Ontarians, that Doug Ford is obsessed with his electoral calendar rather than making sure that we get through, as I said, COVID-19 and get to the other side. We've seen the government put out, I'll say, arbitrary dates regarding removing mandates and moving through COVID. I suspect that it's not a coincidence that the dates that they put out into the public domain will take place in advance of next year's election campaign. But this is not the way. The way that Doug Ford's doing it is not the way to get through to the other side of this pandemic. We need real leadership at this moment to make sure that if there is to be a fifth wave, if I can put it that way, of this pandemic, that it is something that we can all deal with, that we can deal with it quickly, that no one who doesn't need to get sick gets sick, and that no one who certainly needs to die doesn't die. That's what we want to avoid, all forms of tragedy at this point, especially given what we've had to go through since the beginning of this pandemic. And so today, we are here to call on Doug Ford to take a look at three critically important areas to make sure that we are focused on not an arbitrary calendar or dates on a calendar, but actual actions that will help us get through the balance of this pandemic. So first of all, vaccines. You've all heard me and the rest of our team. We've been talking about vaccines and the need for strong vaccine mandates since July. So in particular for healthcare and for education workers, we need to see an aggressive rollout plan for both booster shots and for the first and second doses for kids who are between the ages of 5 and 11, once the vaccines are deemed safe and effective for those in that age category. I want to talk about ventilation today. We know that COVID-19 is an airborne virus. That's what the science tells us, and we need to see, certainly in schools where there is some work that's being done, but beyond schools into other public settings, including businesses, we need a focus and resources to be applied to make sure that the ventilation is where it needs to be in as many indoor settings as possible to limit the spread of COVID-19. And the last category that I'll reference is something that we've been calling mandating safety. And this is to do everything we possibly can to protect the most vulnerable Ontarians that we have, those who work or run small businesses, those who are healthcare heroes who have been greatly disrupted, disturbed, and attacked by the anti-vaxxer movement. It would seem in all of this, to me and to the Ontario Liberal team, that Doug Ford, especially as of late, has been far more interested in catering to that anti-vaxxer component of his electoral coalition, instead of focusing on the people of Ontario, who, as I said right off the top today, desperately need real leadership from a premier who's going to take strong, decisive action at this moment, at this precise moment, to listen to the science, and to get the people of this province through to the other side of COVID-19. Now I'm going to ask my colleague and good friend, John Fraser, Ontario Liberal MPP from Ottawa South, to weigh in. And then Jill and Nathan will have a chance to speak as well. John, over to you.
Thanks very much, Stephen. And as Stephen said, we're at a critical point in this pandemic, and we need to strengthen our mandate for safety to protect the most vulnerable, protect our small businesses, and our healthcare heroes from all the anti-vax harassment that we've seen out there. So the government needs to do more to keep small businesses and workers safe. Vaccine certificates, they're an important tool for businesses and organizations to create safe spaces for workers and their customers. And those certificates, they need to be strengthened through the use of QR code, and they need to be in place as long as businesses and families want it. It's their tool. Rapid testing. There are millions and millions of rapid tests still going unused in Ontario. These game changers that Doug Ford called them game changers. Well, they've been sitting on the sidelines and they're not doing anybody any good there. And the government needs to move to provide greater access to those. The government needs to reinstate make 10 paid sick days permanent. There's a private member's bill with that regard. It should be passed. There's been a rise in anti-public health and anti-vax protests at our schools and our hospitals. And the government needs to do more to protect our nurses, our doctors, our healthcare workers, our educators, and it needs to pass safe zone legislation. They have Bill 2 on the books right now. They can pass it. It creates safe zones around hospitals and schools, 150 meters. The government needs to do this. And finally, the government needs to go to a third round of support for Ontario small businesses. And I'll turn it over to Jill. Thanks.
Sorry. Thanks everyone for being here today. While vaccines aren't a guarantee, they are our best first defense against infectious diseases like COVID-19, significantly reducing rates of infection, hospitalization, and death, and the chance we'll pass on infection to everyone we come in contact with. We know that when illness enters a workplace or classroom, it doesn't just stay there. It passes on to others and comes back home to our families and communities, including people who are more vulnerable and may not survive if exposed. For many people, infectious diseases like COVID-19 can be miserable, but the greater concern is the risk of spread to people who will face more serious consequences and the burden of our healthcare system when we fail to control community transmission. Our hospitals are carrying a severe backlog of canceled procedures because of the pandemic and are struggling to meet the needs of Ontarians who are waiting too long for cancer surgeries, hip replacements, and many other concerns. Community immunity through vaccination doesn't only protect us from the diseases we're vaccinating against, but from having other serious health concerns put on the back burner. COVID-19 doesn't spread on its own. It passes from one person to the next, and every vaccine could stop transmission and break the chain, protecting our loved ones and our neighbors. It's vital that we use this tool to its full potential as we continue to work towards the end of the pandemic. Nathan?
Thanks very much, and thanks for having me here this morning. What we know is that there will be an end to this pandemic, but we also know that relying on vaccines, which I agree with my colleague Jill, are the strongest tool to end this pandemic, will unfortunately likely not be enough to get us through the winter. And you will know that I served as the Assistant Scientific Director of the province's Science Table. My colleagues at the Science Table just released their modeling last week, showing that the rise in cases that we've been seeing in Ontario over the last couple of weeks are real, and they're unfortunately likely to end up in increased intensive care unit admissions. And what my colleagues made clear from the Science Table was that we need a layering of protections to get us through the winter. My colleague John Fraser and Stephen Del Duca have spoken about some of those, and I'm really proud that Stephen has also acknowledged, I believe as perhaps one of the first political leaders, that COVID-19 is airborne in terms of its transmission. And what that means is that focusing on layering of protections is of utmost importance. So we need the ongoing public health measures, and we need the supports that John talked about for our hospitals and businesses. But Theresa Tam herself, the Chief Medical Officer of Health for our country, acknowledged last week as well the airborne transmission of this virus. The fact that there are particles called aerosols that linger in the air like smoke. And what that means is two things. It means use of proper masking that comes along with acknowledgement of airborne transmission, but it also means that we need to enhance ventilation and filtration. Something that I would argue has received considerably less of focus than the other measures that we've talked about today. So ventilation is the supplying and distribution of air. So we can do that through natural means like opening a window, or it's through upgrades to HVAC systems. Filtration is taking that same air and passing it through a filter and then recirculating it. Stephen mentioned that we've done some of this in our schools, but we're also at a place in our province now where we are having people congregate in large numbers in indoor settings, and we haven't had the same focus on improving ventilation and filtration in other indoor settings where we know COVID-19 spreads. So this is just to reiterate that we need our government at this point to be proactive and not reactive. The point of the science table and the good work that my colleagues are doing on the science table is to give us that mirror so we can see around the corner. And if we're not proactive in implementing these measures, we may have the same preventable suffering and harm and deaths that we've seen in previous waves. And the goal with all these measures is to allow us as Ontarians to continue enjoying some of the more quality of life that we have all had over the last couple of months, and not needing to regress and move towards reimposing restrictions. That happens when you do things too late. And so we are calling on the government to be proactive. Ventilation and filtration is a tool that is necessary, combined with vaccination and mandating safety and support for public health measures. And it's critically important that we take proactive action on this and not be reactive, as we have seen Doug Ford and his government do repeatedly throughout this pandemic. Thank you for the opportunity to speak. I'll pass it back to Stephen.
Thanks very much. With that, I'd be happy to take any questions that you might have.
Okay, just a reminder to reporters on the line, if you have any questions, please write to the chat and I will add you to the queue. The first question is Jeff Gray from the Globe and Mail.
Hi, Stephen. Hi, everybody. Can you hear me all right?
Yep.
Just wanted to ask about the childcare issue. So we have a deal in Alberta now. I think it leaves Ontario and New Brunswick to go. You've spoken of this before, but can you, can you offer any explanation as to why the government seems to have taken so long to make a deal? Do they have any intention of making a deal, do you think?
Look, I don't think Doug Ford believes that universal licensed affordable childcare at $10 a day. I don't think he thinks it's a priority. You've all witnessed firsthand for the last number of weeks, Doug Ford is obsessed with two things. Well, I'll say three things. He's obsessed with his own re-election chances, number one. Number two, he's obsessed with destroying the Greenbelt and paving over farmland to build highways that don't make sense. And he's really, really focused on rewarding his friends who are already doing really well and don't need a premier to be there to back them up. The people who will do better because of those mirage highways that he's proposing to build. So I don't believe inside of himself, Doug Ford thinks that childcare is a priority, and it shows. I would never have thought at the beginning of this process that Jason Kenney would beat the Premier of Ontario to a deal on childcare. It's shocking, it's discouraging. And I think it really clearly shows what Doug Ford's priorities and what his values are. And they are not the kinds of priorities or values that I think most Ontarians have.
Do you not share any of the concern, though, about Ontario's the only province with full day kindergarten, and there's some dispute about how much money Ontario should get because of that, or the concern about will the money keep flowing, or is this another program that gets started and then the provinces have to pick up the excess?
No, look, there is an urgent need right now in this province from an economic standpoint as well as a societal standpoint. We have seen women's participation in the workforce drop off precipitously, drop off a cliff during this pandemic. We need people to be able to go back to work, particularly working moms. They need that peace of mind, knowing that they can have that support. We also know this is a huge pocketbook issue for hardworking families in this province. I mean, when you think about what the annual savings will be to a family that can access $10 a day licensed childcare versus what they're paying now, It's huge. And we know right now that pocketbook anxieties and concerns are a big deal for the people of Ontario. So I think Doug Ford and his team are throwing up a bunch of roadblocks that other provinces understand don't make sense. Alberta, the rest of this country, save and except for, I believe, as you said, New Brunswick, they all got it. They all signed on. They understand that when the federal government wants to invest to the billions of dollars to deliver on this kind of system, that it actually makes sense. Only Doug Ford is stubbornly obsessed with highways that don't make sense and rewarding his buddies rather than focusing on the hardworking families of this province. So I said this back in May when I announced our plan for childcare, that working closely with the federal government, you got to do the right thing here, Doug. The people of Ontario need you to actually do the full job of being premier, not just the things that you like to focus on or your campaign team tells you to focus on. You have to focus on the full job. And right now, delivering on childcare is a huge priority for the people of this province.
Okay, the next question is Sinead Dougal from QP Briefing.
Hi, good morning. Thanks for taking our questions. First off, just on ventilation, I'm wondering if you can kind of give more specifics on what you'd be looking for. Are you looking for the province to provide funding to businesses or mandating standards? I mean, funding could end up being a pretty expensive proposition. So what are you looking for there?
Look, I think, so first of all, I think this work should have begun in earnest last year. I will say, and I acknowledge this in my comments this morning, that we've seen some progress with things like HEPA filters, for example, in schools, a pretty significant federal investment to help the government of Ontario do better, do a little bit better around ventilation and air quality in our schools. I think the work should have begun over a year ago. I think every option should be on the table. I know John Fraser in his remarks today talked, as we have in the past, about the need to open up an additional round of small business grant support from the government of Ontario. It's possible that financial resources could be brought to the table for the discussion. But as we've all said this morning, we know with increasing numbers of people heading back indoors because the weather is getting a bit colder here in Ontario, this is something, given that we do know as well that the virus is airborne and it's transmitted in an airborne way, if I can put it that way, not having scientific expertise. We need to do better around ventilation and filtration. So whether it's financial resources, whether it's standards, whether it's working with the HVAC community, there's a whole bunch of options available to the government, but you actually have to step up, lead, and sort of take charge of this issue. And so far, outside of schools, where there's been some limited progress, it doesn't seem like the government's prepared to go down this path.
Thank you. And for Dr. Stahl, just hoping to hear from you about the whole issue of mandating vaccines for healthcare workers. As a healthcare professional, just your take on the government's position on that and concerns over staffing resources, especially when the province is trying to tackle this backlog. So yeah, if Dr. Stahl could just address that,
please. We'll give him a second to see if he can jump back on. I think he's jumping back on right now.
I can't, oh, there, the host is out. There we go. Hi, thanks for the question. So, we have seen, the Premier and the province of Ontario asked, again, my colleagues at the science table, as well as multiple other healthcare professionals and organizations, for their opinion on mandating vaccination for healthcare workers. The overwhelming response that was received from the Ontario Hospital Association, from the Registered Nurses Association of Ontario, from the Ontario Medical Association, from the COVID-19 Science Advisory Table, was not only is this the right thing to do to protect vulnerable patients, but there is scientific evidence to support mandatory vaccination for healthcare workers. And this isn't a political issue. We have seen other provinces with conservative governments like Nova Scotia move to make vaccination mandatory for healthcare workers because we know it's the right thing to do. We have heard from the government that this would cause a catastrophic loss of healthcare workers that would interrupt services, but we haven't actually seen the evidence to substantiate that. which is very concerning. People like Anthony Dale from the Ontario Hospital Association have repeatedly said publicly that hospitals and healthcare systems would be able to mitigate any small losses that might occur from individuals who are choosing not to be vaccinated and who do not have legitimate medical exemptions. As a scientist and as a doctor, we need to substantiate the claims that are being made that this would result in significant service interruptions. And so to say that without substantiating it with evidence is concerning and does highlight what Stephen talked about in terms of pandering to a small vocal anti-vaxxer community. And looking back at Doug Ford's comments that he made over the summertime, that he believes it's the fundamental right of healthcare workers to make a choice on this matter. The fundamental right exists for an individual to decline vaccination, but it is not a fundamental right for anyone to work in healthcare, especially when you're dealing with frail and vulnerable patients. I'm on service in the hospital today. I know the patients that I'm going to look after today want all their healthcare professionals that are providing direct and hands-on care to be fully vaccinated so that they can be as safe as possible. And I think that's where we need to be considering what the experts have told us, what the scientific evidence suggests, so that we can move forward to best protect Ontario's patients, and not only Ontario's patients, but our healthcare system, because we know that COVID-19 outbreaks also result in substantial health human resource challenges that challenge our system. So this is an issue that we've had clear response from the experts in our province, and that we need Doug Ford to move on. And frankly, it's weeks and months too late that we've not had action on this issue.
Okay, the next question is John Michael McGrath from TVO.
Good morning. One of the points in your release is about having an aggressive plan for third doses, and I'm wondering if you can put some meat on that. Are we talking about expanding the age eligibility? Is that what you would like to see? Or, I mean, there's a debate right now in the US about actually just like third doses for all adults, everyone over 18, and I'm just wondering what you would like to see.
Yeah, I mean, I think that's definitely an option that we should consider. I talked with my parents over the weekend. They're both in their. My mom hates it when I disclose her age, but they're both a little bit older. So there was just a little bit of confusion about what they're eligible to do, what they can be doing. I think it's been unclear now for weeks and weeks and weeks about how the government's going to roll out booster shots for those people who should be getting them. I think it's been really unclear about what the plan is in addition for what they're going to do for kids under the age of 12 and how they're going to roll out the vaccines and help make parents comfortable and educate parents that might have concerns, parents who have kids under the age of 12 once those vaccines are deemed safe and effective, as we say. So I think every option should be on the table. I mean, look, if I was told I should or could go get a booster shot tomorrow, I'd be in line. I'd want to get out there along with, I think, most Ontarians, especially when we see the case numbers going in the wrong direction. We know more and more people are going to be heading and staying indoors for the winter months. And, we've seen in other places, including the United States, how they've started to deal with the booster shots, I think, in a more aggressive way. I'm really concerned that, like so much else that we've seen in the pandemic, that Doug Ford's going to show up too late on this. And then it's going to be chaos. Then it's going to be panic. Then he's going to blame everyone else under the sun when we've known for months that there should be a really strong plan in place. So perhaps it's opening it up wide open. Perhaps there's other things that we should be talking about. But I really think right now there's confusion and there's no clear indication of what the plan is, because I don't think they have a plan.
And thanks. I didn't have a follow-up.
Thank you.
Okay, it looks like there's no other questions on the line. Thank you.
Thanks, everyone.